my name is Grace Eugen O, and I will be setting up an IV Piggyback for validation. So first, I'm going to take care of my 7 steps, which is check the physician's order, identify the patient, introduce myself to the patient, wash my hands, gather all my equipment, explain the procedure to the patient, and provide privacy for the patient. So I'm going to gather my equipment, and I'm going to grab the medication, make sure that the expiration date is up to par and that there are no particles inside the medication. I'm going to grab my tubing and make sure that none of the wrapping is opened and that it wasn't compromised. So once again, I've already washed my hands. And while I'm doing this, I am assessing the IV site, making sure that there's no redness, tenderness, pain, etc. So I'm going to double check the MAR and make sure that the medication is correct. And this is. So here I go. So first thing I'm going to do is grab my tubing. Ready. Spike it. I'll clamp it. And I'm going to be very careful to not touch the white portion of the spike. So here we go. Take that off. And you want to be careful as to not spike the actual bag and just make sure that's completely sealed. Now with this piece, I'm going to make sure that the medication is at a higher point than the IV site, than the medication. So here, and this guy's gonna go here. Just bring this down. So what I am going to do is also make sure that my medication is labeled with the start date, my name, as well as the time that the IV site was taken care of. I'm going to make sure that the original sodium chloride IV was also labeled, because I kind of forgot to do that before. So now I'm going to make sure that half of the chamber is filled with the medication as I prime my tubing, and I will slowly unclamp the tubing to make sure that there is no air bubbles. Here we go. So here it goes, and as I draw near the end, I'm gonna clamp that and make sure that everything is good. So what I'm going to do is set my drip factor to 20 drops per minute, which is 1 drop per 5 seconds. So we're gonna go towards the port. Clean the port side over here. Clean this side over here as well. Make sure it's completely sterilized. Just like so. Okay. So now that it is clamped, I'm going to use the primary clamp and get my drip factor. So once again, I said it was 20 drops per minute. So that's 1 drop per 5 seconds. So So I'm going to set my drip factor to 1 per 5 seconds.
Next up, we're going to inspect our IV bag, then checking the
So here we go. As you can see, the drip factor is 1 drop per 5 seconds, which is 20 drops per minute. Okay, so as you can see, I've set up the IV Piggyback. I want to discard all of the excess pieces that I do not need. I want to once again check the incision site, make sure that there's no redness, swelling, make sure the bed is at the lowest position, make sure the call bell is within reach for the patient. Ask the patient if it's comfortable, if she or he is comfortable, and record I's and O's and wash my hands as I leave, right before I leave the patient.